Congratulations on getting your braces. One thing that you'll get from us is this sheet. On this sheet, it's going to tell you on one side all of the foods that you're going to either want to avoid or eat differently. Obviously, big no-nos are no chewing on ice, no gum, no hard candy. You want to be careful of other things. One thing would be like biting into an apple. Instead, you're going to cut it up into pieces to eat it. Another thing is corn on the cob. You're going to take the corn off the cob and then eat it that way. Any kind of meat like chicken wings or anything that's on a bone, take off the bone before you bite down into it. Ribs, you want to take that meat off the bone. Cooked vegetables are generally better than raw vegetables just because they're a lot softer, so that's the best way to eat vegetables. Instead of getting like a crunchy or hard taco, you want to ask for soft tacos. Nuts, generally you want to avoid them. You have to be very careful. They can knock off your braces, your bracket, and every time a brace or a bracket knocks off, it could prolong your treatment. It could also cause the wire to poke at you. So if your appointment's coming up in a week or two, you might just want to wait to talk to us and let us know at that appointment. Always hold on to your brackets, but if it happens like right away or your appointment's not for a few weeks, please let us know so we can see if we need to get you in. Back to what you should or shouldn't eat. This list isn't going to have everything on it. It's just a general idea. Some breads are going to be really soft and some are going to be hard. Like pizza crust might be really hard, so you want to avoid stuff like that. Anything you're not sure of, just test out. And a lot of times there's like hidden foods, like some salads might have those nuts in them that you're not sure about. So just look around. Popcorn has kernels, so we generally tell you to try to avoid popcorn. Drinking too much soda or anything with too much acid like lemons or oranges, you just want to be careful and not kind of drink too much of that or eat too much of that because the acid isn't good for your teeth. That's pretty much it. You can always look over this. Like we said, it's not going to be everything on this list, but it gives you a good idea. As far as taking care of them, you're going to brush your teeth about 3 times a day. If you can brush at school, that's great. We understand if you want to wait till you get home, but you always want to do your best when you brush. You're going to get a little timer and it has sand on one side and goes all the way to the other side. That's 2 minutes. That's how long you're supposed to brush. We're encouraging you to floss at least once a day, and usually nighttime's the best time for that. So in order to floss, you're going to need to get the floss under the wire. We're going to make a separate video just for flossing, but basically in your kit there's going to be floss threaders. If you can get the floss under the wire on your own, that's fine, but the floss threaders are like using like a needle and a thread, and the floss threader's the needle. You don't actually floss with it, you just use it to get the floss under your wire. As far as anything poking, try wax first. You might want to dry your tooth off and then take a piece of the wax and put it on. If that doesn't work, then you might want to come in to see if we can clip the wire. If any of those little ties, little colored ties around your braces come off, it's usually not a big deal. Don't worry about it. You can let us know at the next appointment. If anything comes out, whatever it is, just hold on to it, put it in a Ziploc bag, and we'll take a look at it to see if we can clean it off and save it, or if it's something that needs to be replaced. That should be it. The first couple days of braces, your teeth are going to be sore, so you're going to want to take some Advil or ibuprofen. If your kid lets your mom or dad know. You also want to just try to have softer foods, usually about 3 days after you're in the clear. Now, every appointment you come into, you might be a little sore. It's not going to be like the first time in braces, though. That's it, and always just let us know if you have any questions. Congrats again.